everyone just wait a couple more minute or so to just let everyone trickle in, and then we can begin our webinar.
Yeah, do not do that.
I've still got a few sort of trickling in, so then I'll kick off. And there might be a few people sort of joining as we go, but that's absolutely fine. Just okay, brilliant. I think I'm going to make a start. So firstly, hello everyone. Welcome. Thank you so much for coming to this webinar today. I hope you're all enjoying the nice sunshine. I'm Kerry, and I'm the Programme Manager for Social Change here at Site. I'm going to be joined today by Hayley Middleton from Henshaws. We'll talk more about that in a bit. Really excited to have Hayley on board as well. So before we sort of get into the main focus of the webinar, I just want to do a couple of housekeeping bits. So live captions will be available during the whole webinar for those who will find that useful. We may use illustrated slides kind of throughout the presentations, but if we do, we will always describe, of course, what is on those slides. So no need to worry about that. Slides, a transcript, and a recording will be available after the webinar. So if you've got, no need to sort of furiously take notes or anything like that, if you don't want to, they'll all be available. We won't share publicly the final discussion recording in the Q&A. We just kind of wanted this to be a bit more of a safe space for you to discuss things that you might want to discuss in terms of the sector and what things that come out of Hayley's presentation. But we may use the recording internally just for sort of awesome references to it, just for our own learning as well, really. And as I said, there'll be a Q&A. We've disabled the chat function for this webinar, but you will be able to ask questions in the Q&A function. This is just because it can be a little bit jarring, and also it's easier for us to monitor the Q&A as well. The webinar will end when it does, quite abruptly. This is just the nature of the program that we're using, so it's not like we're not trying to be rude or to get rid of you, but it will just sort of end quite abruptly. So now I'll tell you a little bit about what you can expect from today's webinar. I'll tell you a bit about our organisation, for those who might not know, and kind of why we fund the project that we're funding. And I'll talk about a little bit more about our research that we commissioned into loneliness and isolation, because it sort of explains, it's sort of an ongoing theme that we've got at the moment for many of our projects. So, and Hayley will be speaking to this as well, so I just thought it would be quite good to talk about that. And then Hayley, she'll be talking about Henshaws and the independence model and the learnings and challenges and indeed successes of her project, of their project, which we are currently funding as well. And again, there'll then be a Q&A, and it's just going to be a really safe space for us to have what I hope will be a productive discussion. So now to the next slide, just a bit about our organisation, a bit of background. We fund brilliant minds and bright ideas that put change into sight for everyone impacted by vision loss. And we've got sort of two arms of our funding, really. We've got our social change funding, and that's sort of what we're concentrating on today. And our projects under this funding streams sort of improve what it's like to be blind and vision impaired and living in the UK. So talking about all sorts of different barriers there. And we then have our scientific research arm, and we fund innovative projects to better understand, diagnose, prevent, and treat vision loss. And so now I just want to, as I said, I really wanted to talk a little bit more about the research that we commission. So we're an evidence-based funder, and so we really want to make sure that our funding, I suppose, is responding to the most critical challenges or needs within our sector. And to do this, we often commission research. We will conduct sector analyses. We will conduct sort of an organised focus group. Some of you might have actually been in those, just to really make sure that how we're using our funding is relevant to you, to the sector, and really can drive that change that we want to change. And as I said, one of the recurring themes and big theme of ours at the moment is tackling loneliness and isolation. And on the slide, there's you see a picture of a bunch of young people and a coordinator sitting around a kitchen table at somewhere called Jamie's Farm. And Jamie's Farm was a project that we did last year in partnership with Look UK. And we organised for some young VI children and VI children, young people really, to go to Jamie's Farm. And there are various Jamie's Farms scattered across the country actually. And Jamie's Farm is all about people getting outside, getting into the outdoors, really making the most of nature, looking after animals, having a really sort of hands-on day. And it can help people to connect and to talk about feelings of loneliness and isolation that they might have. And just really for people to make those friends and really valuable social connections. And that came out of this research that we had commissioned into loneliness and isolation. And VI people are 3 times more likely to experience loneliness and isolation. And this is a finding of our report funded by us and conducted by researchers from Abertay University. And we asked the question, what is loneliness and isolation like for people who are vision impaired? And it's a really tricky question. It can be quite subjective, it can be quite complex. And people who are lonely or isolated are, by definition, less engaged and less visible in our communities. So it can be really hard to kind of reach those people and to find out what's going on. And loneliness and isolation are a severe threat to public health, as cigarette smoking, obesity, and physical inactivity. For Fight for Sight, knowing how and why people experience loneliness and isolation is really important, and it's a really big part of our mission to drive that change. And our goal is that everyone affected by sight loss has access to ways to increase the joy and connections that make loneliness and isolation less likely. So just before I do hand over to Hayley, to give you a bit of an idea about some of the projects that we funded and things like that, our webinar series has delved a bit more into this. And we've had webinars that talk about emotional support, creative and practical ways for VI people to get out and about, which I know Hayley's going to talk a bit more about. And also we've got our webinar in June. I will just plug this while I can. And that's talking about social connections. And we've got Sutton Vision coming in to talk about a fantastic befriending project that we're currently funding and that they have. And it's really brilliant. I went to visit it and it's just wonderful. But now I think you've heard enough from me. So I will introduce Hayley. I want to introduce Hayley by the way of a quote from her colleague Stephen. Preventing loneliness and isolation has always been a part of the charity's work, and the organisation's approach has changed in line with changes in our society and communities. But the work of the organisation is as relevant today as it was 200 years ago when we were first founded. And without further ado, I will now welcome Hayley. Thanks, Hayley.
Thanks, Kerry. So yeah, I'll introduce myself. I'm Hayley. So my role title is Restricted Fund Manager. So I work a lot with projects and grants, and yes, seeing this one come to life has been really lovely. And I've also got Josh with me, who is our enablement officer, and he's working directly on the grant. So hopefully Josh can jump in with any additional things that he thinks I've missed. That's his main help. So I thought I'd start with a bit about Henshaws in case anyone doesn't know of us and would like to know a bit more. We've been around a very, very long time. Officially, we were established in 1837. And so thankfully, yes, along with that quote, we have changed a lot since then because the world has changed a lot since then. With our sight loss support, we support people across Greater Manchester, and then we also support children and young people in Merseyside as well. And it's changed a lot over the years. So we did a little research recently, and in 2007, we supported around 250, we got 250 new referrals each year. So just new people to us, and we worked across 3 of the boroughs in Greater Manchester. And now we work across 9 of the boroughs in Greater Manchester. And just for new people, we get around 1,000 people each year. And in total, we support about 3,000 people each year. So huge amounts of changes and exciting opportunities to support more people, but also all the challenges that come with that. So the things that we have to offer people is it all starts with our pathway to independence model. And the first question we always ask people is, how can we help you? And that might be over the telephone. It might be through our patient support service at the hospitals. It could be people in person, like Josh, who gets to go out and meet people.
Yep.
But yeah, it's all creating a plan around that, and whether Henshaws has the ability to support them, or whether we can work with somebody either locally or nationally to support them with anything else that we don't do. So some of the things that we offer are enablement services, which Josh does, and he does one-to-one support, living with sight loss courses. What have I missed?
Yeah, so we do the personal plan.
Yeah.
So that's obviously where I would work with someone on a one-to-one basis. And those sessions are very much shaped by that person. So anything that they come to us with, that's where I would look, as I said, to the services either locally or nationally, and say, okay, we can do this, we can do this. We also refer internally to digital and also to the counselling service as well, which is really good. Like, gets utilised a lot as well, which is really positive, and it all links in together.
Yeah. So, like Josh mentions, we have a counselling service, a digital support service, which is really popular. We also have a children's service. So, in a nutshell, that's all we do. So, when we applied for this funding, I think we'd known for some time that our sort of social offer wasn't meeting the needs of the people that we're supporting. If you were 10 years old and you came to us and you wanted to do some fun activities and social stuff, great, we've got things for you. If you're maybe above 70 and you wanted to do, cup of tea bingo with other visually impaired people, great. But I think Josh would agree with me, if you're in that middle ground, you don't want to go to either of those things. So yeah, we had a legacy of social groups that were getting older and older. The volunteer support was becoming really, really challenging, in all honesty, finding the volunteers to be able to run those groups, or sometimes having to staff those groups. It was just becoming really challenging. And so we knew we weren't meeting people's needs in that way. And from the phone calls we got, we knew other people weren't either.
It's one of the first things I noticed when I started working here. Again, I would speak to people, older people, and I'd be like, okay, I got told about the historical groups that we had, and I was like, okay, that's great. I can refer into them when they eventually start working again, because I started working during COVID. But that's fine, I can refer into them. I said, but what about people like me? Because I'm VI, working age. What is there out there for me? And they were like, well, not much really. I was like, okay, well, we need to look to change that. So it's been about nearly 5 years, but we're getting there with it now, which is really good. And this project's something personally I'm very passionate about as well, to be fair. So hopefully we can make it work.
Exactly. And so we did a bit of consultation work, and we asked people, what do they want? When do they want it? What sort of things do they want? And we got a whole ream of activities that people wanted to do. They wanted to do mechanics, ukulele groups, DIY, chess, walking groups. And so as soon as that started to come through, we did a bit of online stuff and in person. We realized there's no way we can meet all these needs. So that's when we started to look at mainstream groups and how we can make the things that are already out there accessible. Josh, you work a lot in community centres and libraries, and there's a lot of groups already out there that are offering some of these things, but they're on a poster somewhere. That's not going to help people, and people don't know if they're going to have a good experience when they actually do go to these groups as well. So that's how we came up with the idea of our project. So we wanted to deliver visual impairment awareness training to create a sort of portfolio of accessible groups, to be able to say to people in Greater Manchester, this group has been trained, they have been supported to be accessible. These are all the ones that are available to you. And and very luckily we got some funding for it. So yes, we were very, very excited to do the project. That was when some of the challenges came about. As any project you have, there's ups and downs. So as part of it, we wanted to recruit somebody so that they could specifically work on this and go out to do this. Recruitment is challenging at the moment. I don't know if any of the other organizations are trying. It's really challenging. So we did 3 recruitment rounds. We finally got someone in who was brilliant, great, started to work in the community, make those connections, work with our service users to get connections with them and see what they wanted in their communities. Unfortunately, after 3 months, she decided to leave for her own reasons, and we were going, right, deep breath, what do we do now? And the first thing you do, obviously, is try and create a plan and talk to your funder and say, we've come to a bit of an issue. We're trying to do everything to support us. And from my experience and in this experience, funders are so supportive. They know that it's not always going to go smoothly. So what we did in that case was we looked to our existing staff, because recruiting again seemed like it was going to take a long time and pause everything for everyone. And we started to get that momentum. And so we have enablement officers in the community like Josh, who already have those connections with some community venues, some leisure venues, some groups. And so what we've done now is we've split the project across staff members who are working in those communities. And so we've definitely had some delays. You know, we'd love to be further on than we are, but I think we're starting to get some bookings and things
bookings,
so it finally feels like we're starting to get things off the ground, which is really exciting. And we're starting to create our portfolio of groups as well. And one thing that we have learned as we've gone along, we've learned a lot through through all the challenges and things like that. But one thing we have learned is to be able to also look out for the groups that are already there. So we're working locally with the Macular Society, Berry Blind Society, and putting the groups on that there on our sort of portfolio that are already existing, that, you know, we can go and chat to them, make sure, you know, they're supportive, they want those referrals and things like that. So that's been a bit of learning for us, as well as not reinvent the wheel. And then there's obviously other groups that we're going out to, and we have a user voice group. So they've been great at suggestions of places in their local area and things that they want to do. And Josh, you've delivered one to Cycling UK, haven't you?
Yes.
So I don't know if you want to tell us a bit about your experience of that.
Yeah, they're really good. They come to us through my manager, Justine, got an email off them, and she sort of sent it to me. Said, "Oh, this organisation, Salford, got in touch. Just sort of find out what they offer, how they can do it from a VI sort of perspective." They told me that they have adaptive vehicles and they do VI specific sessions, but they just wanted a little bit more advice in terms of supporting people when they were going to those sessions, in terms of getting them on the bikes and in terms of being able to guide them, and just sort of the language and the general sort of support to sort of offer. So I went down, they're based at Salford University. I went down and delivered a session to them in a classroom there. And then I also taught them some sighted guide techniques as well, around the university and within the sports hall. We had a private session in the sports hall, so it was completely empty. Gave me the space and the time to be able to go through it with them. And they really enjoyed it. Feedback was really, really good. They have now been added to our portfolio online, I believe. I think they were the first one. And they were really, really pleased to be on there and to be part of it. And they've been really supportive in terms of helping us get people to them, and in terms of sending the information over of what they wanted listed within the portfolio of what they specifically offer. So yeah, that's been really good. We've got some other ones coming up as well within Trafford Leisure. They're booked in twice, I think. The cricket ground, they've got a big session booked in with us in the next couple of weeks. We've got sessions with the Energize Centre, a wellbeing hub in Salford, another wellbeing hub in Trafford, Blue Sky, signing up to it hopefully. Just need to finalise the date for that one. But they're all being added, even ones over in Oldham and Bolton. In Manchester, there's a lot as well. So we're slowly but surely building up a real portfolio of places that are having this training that we can add to this portfolio and say to people, these places that have got things going on, the staff have been trained, you can go to them, and they won't panic when a load of blind people turn up, which is the main thing. We don't want people to panic when a lot of blind people turn up and think, oh God, what do we do? That's what our jobs is doing, is going into them and saying to them, this is the way to guide, this is what to say, what not to say, and this is how you can sort of best help them.
Yeah.
So it's really working well.
And I think groups have been really receptive to it so far, and really interesting. Like Josh says, some of them are very set up for it. They have the equipment. There's a shooting club we spoke to who had acoustic shooting equipment. Nobody had ever used it. It was in a cupboard somewhere, because they wanted to be accessible, but they didn't know how, and they definitely didn't have the referrals coming in to people to be able to go to that group. So I think we're at a really interesting point where we're building up those groups that we have around Greater Manchester that are accessible. And then the next stage of the project is to refer people to those groups and hopefully see some successes with that. So it's a real pilot for us. It's been based on a lot of consultation, a lot of work to get to this point. But it's really exciting. And I think the staff and service user engagement to be able to see this become a reality, because for so many years we've seen it as a gap in what we're doing. That's really, really exciting to see. And so I think that's the successes, the groups and things like that. That's their sort of receptiveness has been really good. The challenges have been, well, one was the recruitment challenge and things like that. I think the other challenge is just working with people who are very busy. Other groups are very busy. And so sometimes the logistics of getting to people and making sure you've got the right people in the room is some of the challenge. And then, so where the future, kind of where this project leaves us, I think we've got to see the next couple of few months and then see how that goes. And sort of, we're kind of analysing as we go the data we've got and what's coming through. But yeah, I think we want to see what people's experience are like going to these groups and whether that does. And I think that's something really interesting. Somebody said, I really want to go to a chess group. I really, really want an accessible chess group. So we found one in their area, did some training. They bought an accessible chess set, but you can't make people go. And so this person decided that they're too busy, they've got lives, they've got all sorts of things going on. And so I think we need to see a bit more of that coming through and seeing how hopefully this can really support people. People can get cycling or whatever it is that they want to do. So yeah, we'll hopefully get that kind of data and see hopefully the success. And then in the future, I think it's where we go from this project, whether we look to what we'd love, obviously, is Greater Manchester become an accessible city. That's a huge dream, and we're going to have to chip at it piece by piece and work with other charities to try and get that. But so we've really got to focus in on areas. So there's an area in Manchester called the Print Works, which has leisure and food and things like that. So one of our thoughts is, okay, could we target a place that small and say, okay, this area is an accessible area in Manchester. All the restaurants have been trained. We've assessed because it's a little walking route and things like that. So that's one of our sort of queries in the future, where that could go. And the other thing we have people tell us all the time is, yes, we want social places to be accessible, but also my GP and my hospital isn't accessible. So it's not on the social side, but that's the other interesting thing that comes out and says, great, I can now go to this group and I can now do this, this and this. But when I go to have my appointment, actually the receptionist or the space is actually really difficult to navigate and nobody knows how to support me. So I think that's really interesting for us, where we could take our visual impairment awareness training and how much we could go with it. But it's one of those things that could either be really big or we could go really, really small and centered. And so we're just going to have to work and see the project and see how that works. I don't know if you have anything to add, Josh, about the project and how it's going, or how you can see it's going.
Yeah, I mean, I think it's been well. Obviously, you said there about like challenges. Again, a lot of people, when we're sort of putting it to them, are asking them how much it's going to cost. And again, we've been able to go back to them and say, well, actually, it's funded. So again, a lot of people then have been like really sort of up for it. But then what we do find as well on the back of that is we say, oh yeah, we've got X amount of people signed up, they turn up on a day, and people drop out of it because they haven't paid for it or invested into it. But the ones that have turned up, they're the ones who are invested in it. So they're the ones that are like, right, okay, I'm going to focus on you, and you'll be the ones who'll be sort of my go-to people to really get this off the ground. And the ones at Cycling UK, it was a very small team that did it, but my word, they've been really, really, really helpful and useful with it all. So yeah, it's just about finding more ones like them, which luckily we have done. Everyone else that's come to us from them has been really receptive of it and wanted to do it. And it's spiraling because they're doing it, and then after the back of it, they're giving me contacts. Actually, we also work with this other organisation who I think will be really interested. Brilliant. Give me an email address, give me a name. I'll get in touch with them. I'll get them booked in as well. So today, from one contact, 3 have potentially been booked. So it's definitely getting there. Definitely getting there with it.
Yeah, I think that's one of the things we're going to have to. So we do, after our training, we do some surveys to ask people what they feel confident in and how they found the training and things like that. And something we've got to be aware of is you're only ever training those people in the room, the ones that weren't poorly that day or had a meeting they had to rush off with. And so I think that's one of our questions for a project. How long can we say something is accessible for if there's a staff turnover and things like that? So that's something we're interested in assessing, because our nightmare is that somebody goes to these groups and has a bad experience and they've taken a long time and a lot of confidence to go to that, and we actually make it worse rather than better. So one thing we're quite aware of is getting to the right people in the training room, the managers that maybe can then filter down to staff, and making sure we've got those people. And that can be more challenging in some areas than others. We spoke to a coffee shop and they said our staff turnover is just so high, it would be very, very challenging. That's not to say we can't do it, it's just trying to find ways to work around it.
A lot of places as well have volunteers that will do a lot of the front facing stuff, so it's asking for the volunteers to be part of it as well. And obviously there's always, sometimes with that, there's always certain days the volunteers will work, so it's having to work around that a little bit as well. But we get there with it. I found we do get there with the volunteers, and the volunteers tend to be really engaged with it as well, because they're learning something which they can take away.
So our hope is this becomes part of our model, a part of our pathway to independence model that we can offer people. So when people are calling up or meeting with Josh and saying, look, I want to be able to do more, there's not a lot in my area that can offer me, or I want to do this specific thing, that we can have a chat to them about those groups, or point them to our website, send them out a booklet, whatever it is that they need, and say, we recommend these groups, they've had training, we think you'll have a good experience there, and they can meet your needs.
It's something that I've been asking more about within the personal plan as well, because I know now the places are getting trained up and there are more accessible places within the city. It is a question that I've been adding into the personal plan, like what sort of things are you actually interested in? What do you want to do? And then they've told me, rather than in the past where I've been a bit like, oh, I don't know if there is anything for that. I've been able to actually turn around to a couple of them and say, actually, I do know something that's out there because we train them or we're going to train them. And I can link you to it. And it's just creating more opportunities, which is what this is all about.
Yeah. So I think that's probably our project in a nutshell, Kerry.
Brilliant. Oh, well, honestly, thank you both. I think I just want to say, I think this is such a great example, really, of the work that we like to fund. Those projects that really try to open up cities, make more spaces accessible and to raise that awareness. And as you say, hopefully, the more it's done, the more it will it will spread. And I suppose when some people see certain organisations doing it or certain venues, others might want to, and it's all about that. And what a brilliant way to be setting it off. So thank you so much.
Oh, thank you.
No, that's absolutely fine. It's just honestly just really wonderful. So we're coming into our Q&A, and as I said, we want this to be a sort of safe space and really want people to ask questions. And I know Hayley and Josh have been really great about sharing those challenges as well as the successes. So thank you so much for that, because as you said, any project has its challenges. So I wondered whether I might just sort of get the conversation going in terms of, does anyone sort of, absolutely fine if not, but please feel free to answer, but does anyone are there any sort of themes that have come out of Hayley and Josh's presentation, or any sort of challenges that you can relate to within your organisation, or is there anything that you think is going on in the sector that is quite similar? Hayley, do you think it's just sort of kick us off? Do you think it's a sort of sector, potentially a sort of sector-wide issue? Some of these challenges of trying to set up these projects.
I think so. Definitely, when we've spoken to other people and other charities, the traditional way of having groups and social groups is quite common, and those groups are aging, and it's not an appropriate place for a lot of people to be able to go to those groups. And definitely the volunteer support as well. A lot of these groups are traditionally volunteer led and volunteer run, and what we had is our volunteers were also aging and struggling to keep up with those demands. And it's not to say volunteers aren't out there, and they're really, really good, but it can take a lot of work to be able to get those volunteers and people to commit to coming every week to running that group or supporting running that group, and things can be really, really challenging. So that's what led us to look at a different way of doing these things.
So we've had a suggestion actually as well in the chat about creating some sort of certified system to endorse organisations. So in terms of could that give people sort of more of an incentive, I suppose, to get some kind of, or not some kind of recognition, I suppose, for doing these kind of accessibility trainings? Do you think that could make them a bit more receptive? I mean, it's tricky, isn't it? Like, they should be they should really be wanting to, but I do get that, like, places are busy, but yeah, wondering if that could be some sort of incentive.
Yeah, we have talked about it, a sort of quality mark of these organizations, these groups have received this training. We've definitely talked about it before, and we've talked about it before we had funding for it and were able to put some time and energy into doing this. We wondered whether that might be a way to incentivize places to maybe pay for some training, which would be really nice, and in the future that might be a nice, more self-sustaining model. And if we can use the outcomes of this to go to people and say, well, actually, you've got an unmet audience here. We have this many people in Manchester and they want to do this and they want to come to your group. So yeah, it's definitely something we talked about. The risk is obviously if you say it and then somebody goes and has a bad experience, but that is tricky. But then you've got to weigh up the risk there, haven't you? We can do as much as we can to make that group accessible and hope that they have a thing, and maybe tell them they have to commit to training every 18 months or refresher training doesn't have to be long and things like that. So yeah, I definitely think that could be a really good idea. And yeah, with my funding head on, trying to think of ways that the project can continue in the future possibly.
I think we've had another question come through the chat. If someone could just read that out. I think it's it.
Hi there. This question for Hayley and Josh. If you could go back to the start. Hello, it's Kim from 5%. If you could go back to the start and give yourself some advice based on that, what would it be?
So I have some from me. I don't know if you have it, Josh. So I think the recruitment, I know I've mentioned it a few times. I think recruitment has changed both in our sector and wider, and getting somebody in for a year project is not like it used to be, and that can take a really long time as well if they've got another job they've got to come from and train them up and things like that. I think we'd have initially sat down and go, well, what expertise have we got in the team and what links have they already got in the community? Because the idea of getting someone in to work on a project for a year, that be their sole interest is we thought was the best one, so it would focus it. But really, by the time you've got somebody trained, recruited, up and running, and the recruitment landscape as it is, I think we can now see with you guys doing it with the enablement officers, actually you already have these connections in the community, and that really helps.
I think because all of us within the enablement team, we've been here a fair few years already, so all of us have already built up a bit of a backlog of connections that we have reached out to with that. Some of them did come from Georgia who worked for 3 months, but some of those connections were people that I've spoken to or that my colleagues have spoken to in the past as well. And it was like, oh, like, it's great to hear from you again, sort of thing. We didn't know that she reached out, but it's great that she has. I'm really glad that you want this. Let's get it in, let's get it arranged. So yeah,
and it'll be you that's referring people to these groups at the end of the day, so really great for you to be able to say, I've been to this group, I met these people, and and I know how nerve-wracking it must be to go to those groups and how much support you have to give to be able to get people the confidence to then do that. So for you to already also have the connections with service users, to be able to give them that confidence.
I think as well, like from my point of view, being VI as well, when I go or when someone gets in touch, I always sort of think to myself, well, what would keep me from coming to it? What would I want to know when I go to it? And I asked them the questions. I say, if I was to show you how to accommodate this, can you do it? And they'd be like, yeah, that's fine, not a problem. For most of the time, they say that obviously, everyone has their limits on things. But for most of the things I ask them, like, yeah, we can accommodate that, no problem, as long as they show us how to do it. In terms of like guiding or even just like even just sort of making something a little bit more accessible, however that may be. They have said, yeah, if you can show us ways around it, we'll but by all means we will offer it. So that's been really positive to hear as well.
Brilliant. I actually have a couple more questions, but do we have any more in the chat before I
I know, jump straight in, Kerry.
Okay. So I was wondering, this is probably a question for both of you, and you've sort of touched on it, but it'd be good to talk a little bit more. Do you find that people come to you as recurring like themes or ideas for actually what people want to do? I know you said like there were like lots of different like ukulele groups and that sort of thing, but do you get, now that it's sort of launched and kicked off properly as well, are there sort of similar things that people want to do, similar sort of scenarios that people want to see for in terms of accessibility? I guess there will be, but just wondering about that.
I think so. I'll say the feedback we got from the consultation, but people speak differently to Josh probably than consultation because he's used it for a lot longer. The thing that a very few amount of people said to us, we want to do a group with just visually impaired people. I think was what the main feedback was. I just want to meet people with similar like-minded interests, or even if that interest is just going for a coffee or just doing, a bit of social stuff, but it could be an open group. And I think that was really interesting for us. But also definitely that consultation proved that everyone's different. Everyone has their own thoughts and feelings. I think what does come up quite a lot is sort of physical things, isn't it? Like walking, like say cycling, things like that.
A lot of stuff regarding exercise comes up, to be fair. But it is just exactly what you just said there, Hayley. It is the fact that a lot of people want to meet others with a visual impairment, because it's surprising the amount of people I speak to who say to me that I'm the first person with a visual impairment they've spoken to. I'm like, okay, that's quite surprising to hear, but we can connect you to others, because a lot of people want that. But what a lot of people want as well is to be able to go to these settings such as the Printworks bowling places, you know, normal in inverted commas places, and not feel abnormal or not feel excluded or like they can't do it. That's all they want. So that's been the main bit of feedback that I've had from all of this, really, since sort of starting it and focusing on that.
Brilliant. Thanks, Josh and Hayley. Hayley, a question for you, just a bit more, well, you know, a bit more of an open-ended one. I think you've been at Henshaws now for sort of around 12 years. Just wondering, like, how, I suppose, the challenges have changed. Like, are there still, you know, you were mentioning these challenges. Do you think these challenges are newer? Do you think they're different challenges that might have been 12 years ago? Kind of, yeah, where do you think that's going?
Yeah, it's changed a lot. Thankfully, I haven't been here since 1837, but I've been here a long time. Some days it feels like I've been here that long.
Yeah.
So I think I spoke about the volume of people we work with. That's been hugely changed over the 10 years I'm here. We now have data sharing agreements with the Manchester Royal Eye Hospital, which is brilliant because people are automatically opted in to hear about us unless they opt out, which means we have much less people coming to us saying, I wish I'd known about this sooner. I wish I'd been told about this sooner. Why didn't I know? You know, and then they've become entrenched in their isolation or lack of confidence. And Josh's job is much harder to be able to give people that confidence to come out and do things. So that's really brilliant. But obviously the challenge then, and I think that this comes back around to how many different things that people want now, is we've got 1,000 new people, 2,000, 3,000 people a year to be able to support with all their different needs. And we also support people more regularly now. We support them we talk to them at 3 months post-diagnosis or post-certificate of visual impairment, 6 months and 12 months. And their needs obviously change through that. So we've had to really change some of the ways we work. And so maybe if you wanted digital support or support from Josh years ago, you'd sit down and you'd do a personal plan, and that could take a couple of hours, and maybe it'd be in person, or you'd have a digital training session for a couple of hours. Now we realize that not everybody may need that. They might need a quick support with their phone to be able to access this and this, or they might. So we used to do living well with sight loss courses, and you'd have to go on all 6 sessions and you'd have to go through all of the modules. That doesn't work for us or for people now. They are busy, they don't have things, so they can access different modules in our living well with sight loss courses. And Josh, instead of referring to our digital enablement officers, Josh might be able to do a quick little support on the phone. So that's one thing that's changed. And the other is the sort of funding landscape, that it's completely different now. So I mainly work with grants, but I do all sorts of funding within my team, and it's much more competitive. Funding is much more short term, and we've got to be on our toes with things. But in some ways that's challenging, and in some ways it makes us more creative, I guess. But Josh, I don't know if you've got any. I know you haven't been here 12 years, but you started in the pandemic, so definitely things have changed.
Oh, definitely, yeah. I can actually see people in person for a change now. Everything was over the phone or like this through Zoom. But yeah, because it's weird because when I started, I initially covered the Manchester area, and since then I've then gone into Salford and Trafford, and it's good because I found that places in Salford and Trafford are really accommodating for me to be able to go and meet people in the community. When I asked them, can I use a space or use a room or what have you, a lot of them have said yes, not a problem, it's absolutely fine, because they've had that lasting relationship either with myself or with Henshaws previously. So again, I found that I'm in the community a lot more, which obviously I didn't have the chance to when I first started, because I wasn't allowed to. But that's great because again, as Hayley sort of alluded to there, when I first did it, meeting people face to face, a personal plan would take me 2-3 hours because you go through everything with them. Whereas now it's a bit like, well, it can still take me that long, but I know that there's things that I don't have to spend time referring to because I've had training to show people how to do something like read a message on the phone. So they don't have to, it sort of takes the need for them to wait 6 to 8 weeks for an appointment out, as because I could do it with them in 10-15 minutes there because I've had the training now. Whereas I didn't have that at the start because I couldn't do it over the phone with them. If I tried to explain it over the phone, they get confused and I get confused as well. So that's definitely changed for the better, I think.
Yeah, and I think so. The socialization is a huge thing. The other themes that we've seen are digital support. When I started trying to convince people that they could get support from their phone or whatever it was, the team found very challenging. People didn't want anything to do with accessible phones. They didn't want it. Now we have a 6 to 8 week waiting list because, you know,
so many people.
The world has changed and everything. People want it. And the same with our so we have a counsellor, you know, offering people counselling years ago. People go, no, that's very not for me. But again, the world's changed and people are much more open about it. So our counsellor is very busy and helps a lot of people. And sometimes that's really important for people to be able to go onto these social groups as well. They might not feel ready for it, but possibly after some counselling sessions, a bit of wellbeing support, they do feel ready for it, we hope.
That's brilliant. Thank you. It's Kim from Fight for Sight again. I think we're just about to wrap up. I've got one last question to ask on behalf of Fight for Sight to you, Hayley and Josh, is what does it look like for you and your members?
I think it kind of comes back to what we said earlier, or what I said earlier of the thing that we hate to hear is, I wish I'd known about this sooner. Yeah. I wish I'd heard about it. I wish I'd been able to access this and known this. It gives me a bit of goosebumps, actually. We really hate to hear that. We want to help people at the earliest opportunity so that it doesn't become really difficult for people and really difficult for Josh.
Yeah, it's about so a phrase that gets used a lot, that I've used, that gets told to me a lot, is about stopping people or preventing people from reaching crisis point. So if they don't hear about us soon, as Hayley says, you know, you can find someone very, very far into their self journey who are either they've reached crisis point or they're very close to it, and it's about getting them back from that, pulling them away from that, which can be quite hard. So the earliest we are able to make contact like this and say, actually, there's X, Y, and Z out there that you can do, it gives them, it's uplifting for them as well as it is for us. So I think that it's just more people accessing more services, us reaching more people. I think that's what good looks like to me anyway. Probably different for you, I don't know.
No, I think that is for me, especially if we reach an adult in Greater Manchester who has maybe had a visual impairment since they were a child, and we've offered children's services, and we have lots of ways of reaching people, but there are still people that get through the gaps, obviously. And so the prevention of that, and, you know, somebody saying, I wish I'd had this support as a child or a young adult, and now I'm this. So it's preventing that, really. That's what good looks like, I think.
I agree, and I think, you know, you said that prevention is so important, and I think you're doing a really wonderful job to try and tackle that. I think just sort of to wrap up now, but I think all of this has just been so relevant today in terms of, you know, what's going on in the sector and what we can do. And it seems to be that sort of the main challenges around these sorts of projects replace recruitment, as you say, kind of sustainability, and also just getting people and training on the go, getting people engaged and things like that. But, you know, having said that, obviously these challenges are going to be with us, and we've got to find innovative ways of getting around them. And that's not to, you know, I don't want that to take away from clearly the success that this project is having. So thanks so much, Josh and Hayley, for sharing all of this, and thanks also to everyone for coming and listening. I really hope that you found some sort of thought-provoking things there to take back to your organisations. And before I sort of let everyone go, I just want to introduce or to advertise the next webinar in our series, which is going to be on the 22nd of May. This is going to be between 1 and 2 p.m. and it's going to be one of our scientific research webinars. I believe the sign up link will be coming at you on the slides now. But this is looking at artificial corneas, preparing artificial corneas for transplantation. And it's quite a significant area at the moment. There are lots and lots of people throughout the UK and indeed the world waiting for cornea transplant. And as they're waiting for these, because there is a shortage of donors and of corneas for transplant, people's sight is worsening. So we're going to be speaking to Dr. Hannah Levis and her team, who have coming up with a more sort of efficient way of getting these waiting lists down. So if you are interested in that, I think it'll be a fantastic webinar. Then please do sign up and come along. Also, if you want to read our outside report, so the report I was talking about with our loneliness and isolation research is also on our website as well. So you'll be able to access that when you like. And it is a really sort of thought-provoking read. So if you haven't read it, would urge you to have a look at that. But again, thanks everyone for coming. I hope you enjoy the rest of your day and indeed the rest of your week. And Hayley and Josh, thank you so much again. And we'll look forward to seeing you all at a future webinar. So thank you very much.
Thank you very much. Goodbye.
Thank you.
Bye-bye, everyone.